Hello to our listeners. This is another episode of our 20-minute clinic, a podcast for primary care colleagues across North Cumbria and beyond. I am incredibly grateful today to have along Dr. Neil Margerison, someone who I've looked up to early on in my journey. I think he's doing wonders over at Cumbria Health. I'm so grateful to have him on board just to talk through his journey as well as hearing more about Cumbria Health alongside Paul.
Hello, I do the wires and keep them on track, pretty much.
Neil, thanks so much for taking your time up and coming along.
No problem, Andy. Pleasure to be here.
I've had a good chance to spend some time with you and learn about your journey as well, but I'm really keen even for our listeners to hear what's been your journey.
Well, interestingly, it's 40 years now since I qualified as a doctor, which is quite startling, I know, which is quite frightening, really. And most of it's been in general practice, of course. So I was a partner over in West Cumbria for a wee while and then came over to Carlisle to be a partner, mainly on the back of wanted to be a GP trainer. But I did the West Cumberland then vocational training scheme, so I'm pretty well steeped in Cumbria. Plus, I grew up and educated, well, that's a broad kind of comment, educated-ish in Carlisle. Yeah. So I kind of feel very, very bought into Cumbria, North Cumbria in particular. And then I kind of had a change of course about 11 years ago and was fortunate to get the role of medical director at what was then CHOC, Cumbria Health on Call. And as you know, and a lot of the listeners will know, that's grown into something quite different from what it was right at the beginning when it was effectively a cooperative of GPs who didn't want to do their on-call nights anymore, which I was one of them, and it was pretty awful, and it was a good decision, and things have grown from there. So that's it in a nutshell, really.
Fantastic. I mean, I'm always intrigued about the story of QDoc. I still have patients to even talk about it, because it's so deeply entrenched in Cumbria, isn't it?
So it's QDoc before CHOC?
Yeah.
Okay.
What was the journey there?
I'm going to sound really old here, but we didn't have computers, we didn't have mobile phones. We were lucky to get an orange for Christmas, all that type of stuff, And we had little Vauxhall Astras. Other makes of Vauxhall Astras are available, of course. And we just scuttled around. We didn't have bases. We didn't have treatment centres.
Wow.
And I remember the first shift we did, we had to write all our contacts down. And I came back, this was over in Whitehaven, with a massive bundle of paperwork coming out the windows and all over the place. Paperwork was kind of getting caught in the wind, and wow. I was running down the street in part, and
those were the days.
They were good days. They were good days. Yes, and of course, on the serious note, this basically meant that as GPs didn't have to do our night, do the day, then do the night, and then the following day we didn't have our wives answering the phone. 90% probably our wives knew just as much, if not more, than we did anyway. So I think it was an incredible journey, and then of course that morphed into Cumbria Health on Call as GPs were allowed to then give up their QDoc commitment. And I remember being paid by other doctors to do their QDoc shifts. So there's a little mini industry going on within QDoc. So it's been an interesting evolution, and obviously one of our colleagues who developed QDoc are no longer working, but we do have to thank them as a generation, I think, to have that innovative approach, really.
Sounds amazing. And at the time, was that quite novel across England, or was that an emerging trend?
I think it's an emerging trend because before QDoc, towns used to have town rotas. So, for example, in where I was working, Egremont, we used to have an Egremont and Whitehaven town rota. So it's a bit like QDoc, but you were on your own in your own car. Of course, we didn't have sat navs and all the rest of it. I mean, it seems an age ago, and it probably is, but it was an interesting in time, really.
I'm always amazed to hear about the story. I mean, and we're not talking a million miles away, are we? We're talking, mid-2000s?
This year, Cumbria Health is celebrating its 30th year, including all the add-ons. So it's probably, it's late 1990s, isn't it? Wow. That type of thing.
Fantastic to hear that journey. CHOC, as I recall it, and now Cumbria Health, has been on a real journey, hasn't it? What's been the progress of the last sort of 10 years or so? It's really developed.
And do we need a swear jar for when we refer to it as CHOC still?
Well,
it's still quite new in the...
my chief exec will still be very annoyed with me because I still call it CHOC. But then sometimes it's like any other language with patients in particular, isn't it?
Yeah.
You have to connect with them at the right level. And if they know you as CHOC, that will do for me. I'm not that bothered. And there's something about CHOC doctor that that sounds quite nice.
Yeah.
But then there was a nice thing about the Q doctor. So it's all kind of like evolved, hasn't it? I mean, I think in terms of evolution, I think it's the old thing, isn't it? Some of it you have to do, some of it you see opportunities and do. And there's some things that we have looked at and haven't done. And I don't want to sound too kind of pompous about this, but, if you have some really good values at the bottom of what you're doing, it kind of directs you in the right direction, if that makes any sense.
No, absolutely. I can see that as well amongst the team. Shock and Cumbria Health have kind of morphed in from being a predominantly out-of-hours service into being some in-hours as well. What's been that journey for you in all this?
Yeah, well, I think when you look at what we've done over the last 10 years, probably the biggest, if I was retiring today and someone said, what was the biggest thing you've achieved, amongst the relatively small things, people will look at the COVID pandemic and stuff like that, but actually integrating with 111 was probably the biggest challenge and the biggest success, because here was a big beast that could have easily taken over the whole of the world. We were able to work with them in a very kind of partnership way, and I know people use collaboration and partnership as throwaway lines nowadays, but it was a genuine plan to work together for the best of the patients, really.
Yeah.
And of course, so that was probably the biggest achievement. And then moving down the line from there, we recognised that as an organisation, we couldn't just sit on the out-of-hours periphery. We had to get involved in daytime practice because, if nothing else, a lot of our, particularly GPs and AMPs, wanted that mixture of work as well. So to appeal to them, we also needed to have a daytime offer as well. And the kind of, in a way, the rest is history, but we were also driven by the political need, if you like, that a very sort of esteemed colleague of mine said, you need to have your tentacles in lots of things, because then it's harder for people to, I don't know what the word, kick you out of the system, for want of, I think that was his quote. So one of the things is to make yourself indispensable to the system, and one of the ways of doing that, of course, is to get more involved in daytime practice, because if we're not there, then, as you know, I mean, we've got 3 practices in the north of the county that we manage, and 3 in the south, so it's them become integral part of the system, which supports the system as well. So in a way, lots of positives about getting into the daytime.
Yeah, I can see where that comes from, and I suppose it gives Cumbria Health an expanding role within the wider healthcare system.
Yeah, very much, and I think you have to have a vision, don't you? And I know, I'm sat in Carla Healthcare today, and which was part of my old practice, of course. And I know you had a vision, and I think if you've got a vision of where you want to be, you stick to it, and you don't take on stuff that you can't do or don't want to do, so you can make your vision more real, really. So that's always been our vision, to become more involved across the system to support all of primary care, which is what we want to do, really.
Are you doing dentistry as well? Am I right in thinking that? Or
Yeah, well,
part of that?
Yeah, there is an urgent dental service which runs at Wavell Drive, and that's a partnership with obviously the dentists. I'll be brutally honest, I don't have any clinical input into that, because I'm not a dentist, I suppose, which is fair enough. But I mean, a lot of our governance and HR and operational supports through ourselves, and dentists come along and do what dentists do.
And it's a massive help, because I think we see it, don't we, even in Carlisle, and I think we know this across all of Cumbria, really. There's a real strain on access to dental services, so knowing that there are organisations out there to support access, something definitely in that. So no, absolutely. Just thinking about vision, Neil, I'm always intrigued. What's the next step for Cumbria Health? What do you feel as though our listeners should be aware of about innovations ahead within your organisation?
Yeah, well, I think the first thing to say, we're in a period of trying to consolidate. I mean, I think there's always been this sense that Cumbria Health's been a little bit expansionist, but to be honest, we've never taken that view. What we've tried to do is do more within our remit, which of course is generally out of hours, working with North West Ambulance Service, 111. But we've never had an expansionist feel to what we were doing. The practices were all in need when we took them over, so they weren't off-the-shelf perfect practices. So in terms of moving forward, we're not always looking to do stuff. We recognise we're relatively small organisation in the scheme of health. We've just got to be very careful we don't over-expand, and I think we're very, very kind of cognizant of that at Cumbria Health. So we do what we do where we think we can lend our expertise and skills, but we're not in any way trying to sort of, take over the world in any shape or form. And I've never quite understood why people have felt that, because we filled gaps which other people weren't filling. But, I get it. Everyone's kind of like trying to sort of do the best.
And I suppose this is the role of some of these podcasts, isn't it, really? Just to allow those sort of discussions to go on. Neil, I've had a great opportunity to spend time with you and kind of hear about the journey you had. And knowing that Cumbria Health is not an adversity, but they're very much to support and help primary care.
Completely. And I think part of the thing, and again, I'd use your practice as an example, when you get bigger, you automatically have to have more management, you have to have more structure. We both have had new buildings, but that doesn't mean that we're trying to dominate the playing field. We're just trying to adapt and be more efficient. Because the elephant in the room, it's not particularly an elephant, is it? It is the finances of the world. If you don't look at those, you don't survive, really. And that's been a great learning curve for me, because as a GP, you sit in practice meetings, nod your head occasionally, and the accountant comes round and tells you the good or bad news. Well, in my role, you've got to be much more kind of responsible, and accountability of public money is a massive thing for us, because, as you know, we're a social enterprise organisation, so we can make surplus, but it all has to go back into the organisation.
And I suppose these wider organisations all working together strengthens the system?
Well, it does, and I think we're quite lucky, really, because we're part of something called Urgent Health UK, which is a bunch of like-minded out-of-hours organisations, and I think I know not all of them are fortunate to have the relationships we have with our practices. And previous to this, the CCG, we had a very good relationship to them, and the ICB. So, I think we are in quite a fortunate position up here.
I'm always intrigued to hear about how we compare across Cumbria, across other areas, because I've got family and friends elsewhere in the UK and hear about their experience with out of hours. I always hear really good things about what we've to offer. Is that from what you hear as well across the UK?
Yeah, it is, and again, Urgent Health UK does various benchmarking audits, exercises, etc., and we do usually pretty well in those. But again, I think one of the great bonuses of Cumbria Health is the buy-in from local GPs and nursing staff. Of course, most of our control staff and admin are local people anyway, but I think there's a sense of locality about everything we do, which we're very, very fortunate. And one of my big things is to keep the local GP buy-in working for us, because if you lose that, you just become a remote organisation. So, I'm very grateful to the local GPs and AMPs who still rock up to a shift, do the job brilliantly. And of course it helps me, because I can go home reassured knowing that these people are on shift. And there's not no disrespect to the locum from Milton Keynes, but I don't know that person, I don't know his background or her background, so having local people is so important to us.
See, that's really nice to hear, because I think there's always a worry as an organisation builds and expands, will it lose its identity on a local footprint? So we're hearing that Cumbria Health very much is keen to kind of keep some of that identity present.
Oh, completely. Yeah, absolutely. And it just reflects the local organisation working in a locality with its local clinicians, and it's so important to us,
A couple of sort of questions before we round up, really.
Yeah.
What with our trainees, for example, I'm sure we've got a few GP trainees are listening in as well. Any advice to them? Early in their journey, it's quite scary at the moment, isn't it? There's always a worry about jobs and what the direction of travel is for general practice. With your experience, what would you say to them?
Take your time. Don't rush anything. In my day, if you didn't get into a partnership on the first day you qualified as a GP, you were seen as a bit of a flop. So just take your time, put your feelers out. I think portfolio jobs are very useful. And we have a lot of newly qualified GPs come to us full time. We fully expect them to dwindle into a portfolio, not dwindle, but they adapt their work life to become portfolio GPs. For me, in a way, as long as they're in the area, it doesn't matter to me. But take your time. Out of hours is a great place to work, because as you know, it's kind of one patient, one case, move on, one patient, one case, move on, do the best you can for that case, and then off you go. And of course, it's admin light, which I know is a big attraction to a lot of GPs and AMPs in particular.
Fantastic. Final question, which we're trying to create a bit of a theme, aren't we, Paul?
Yeah, he wants to do like a bit of a compilation album at the end of the year.
Steady on, Paul. Come on, steady on. So if you could, what would be one thing that you would change to allow you to do a better job as a GP, as a doctor?
It's an interesting question because I'm not from the school where I think loads and loads of money is necessarily the answer.
Yeah,
I take a slightly different view, which people may disagree with. If I had a solution to my job, it would be having a dedicated, frail elderly, one-stop shop service run by clinicians who were experienced in elderly care, who could turn patients around very quickly, get the transport there, get them back. Because as you know, in out of hours, you have two options usually for elderly frail. You either keep them at home, or you send them to A&E. What you really, if you had a building somewhere that was full of skilled professionals in elderly frail people who you could get in the front door and out the back door, it'd be brilliant. I suppose that's a bit old-fashioned because it's like an old cottage hospital job, isn't it?
You know what?
That's
will it roll back round?
That's what I think would make a massive difference.
Wow, it's really interesting, isn't it? Because I'm sure they existed in one way or the other with that cottage hospital feel.
Yeah,
I'm learning, and I'm sure our listeners of various spectrums of their career at the moment, things end up coming back round. So no, that's a really interesting one. Thanks, Neil. That's fascinating stuff. Amazing. Dr. Neil Margerison, ever so grateful again for your time. Been really interesting hearing about the inside scoop at Cumbria Health, what it is, where it's going, and it's very much there to be a collaborative force.
Completely.
Absolutely. Fantastic. I will love to get you back on again over forthcoming episodes, Neil, and hear more about the work you do. But no, appreciate your time. Thank you so much.
Thanks, Amit. Very, very grateful for the opportunity. Thank you.
Thanks so much. Paul, always a pleasure. Thanks so much.
Always
mate.
a pleasure.
Cheers. All right, until next time, guys, thanks very much, and we'll hopefully ask you to join us again.